I would like to now invite Dr. Domenic, who's the CEO of Schwind, to give his talk on the great vision for all and Schwind Journey in refractive surgery.
Thank you very much. Thank you, Dr. Roth, Dr. Puja. Thanks for a great second edition of the Lenticule Congress, and thank you for the opportunity to share our perspective on an innovation in laser vision correction. So in this second edition, since we take a bit broader perspective and do not only look at Lenticule, I will also try to take a bit of a broader view on the innovation side. So as we all know, myopia is increasing. It's mainly driven by lifestyle, screen time, time spent indoors. We expect myopia to reach 50% of the population by 2050. And we also have other challenges beyond myopia. Aging population, presbyopia is another big topic we're looking at. So we can say it's a big challenge for society. It's a fantastic opportunity for us at the industry to address those elements. So the main treatment option for those conditions still remains contact lenses and glasses, as we know. More than 90% of conditions treated by glasses and contact lenses. There's a growing element or a small element of laser vision correction, still relatively small, somewhere between 3 to 5%. And of course, we have also refractive lenses increasing, starting from a relatively small base. So the opportunity is tremendous. So the big question for me is how do we get to more than 50% in laser vision correction? How do we close that gap? And the good news is the competition is not in the room. So it's not in here, the competition. The competition is glasses and contact lenses, as we know, and educating the patients. So how do we, so what are the challenges? What is preventing us from convincing all those patients? At the Innovation Day, there was a pre-surgery mentioning cost as one aspect. I don't completely share that, but that's the surgeon perspective. I'll come to that later. There's the fear factor, which is big, of course, something happening with your eye, a cut in your eye. And if we go beyond that in innovation, of course, there are regulatory pressures slowing us down, slowing innovation down, which is also challenging and time and money for every company, of course. So how do we go about it at Schwind? Our vision, better quality of life for patient, that led us to today, more than 4,000 eyes actually treated every day. And the target is to double that in the next 2 to 3 years. So what does that mean, better quality of life for patients? As we know, visual impairment, improving visual impairment or let's say reducing visual impairments is a big aspect, uncorrected refractive errors being the biggest cause of visual impairment on one hand. On the other hand, as I mentioned, the cost aspect, actually the laser vision correction is cost positive for the patient in most of the time. So over the lifetime, you reduce your costs, at least in a Western developed world. So that is quality of life on one hand. On the other hand, it's lifestyle, of course, also for very active people especially. But as we know, there was a surge in surgeries post-COVID, so foggy glasses and so forth. So if we look at the market, as I mentioned, summarizing briefly, laser vision correction market is growing. We see an evolution of treatments, new opportunities. We do see certain conversions since we're at the Lenticule Congress, conversion also towards a Lenticule procedure on one hand. On the other hand, the excimer is here to stay. It will not disappear. I think there's still a big opportunity, especially also on the surface treatment side. And for, let's say, providers, you as surgeons, as a company, there's a trend towards more integrated clinics. So the elements we mentioned also yesterday in terms of workflow in terms of data flow, in terms of new application software. I'll come to that in a minute. Training, education, and communication to patients. One of our main pillars at Schwind has always been and still is great results for better vision. So really delivering outstanding results to the patient, to the company. And that's not only the product. Of course, software applications and support of US surgeons in application or in education is a big element. But that has, let's say, fueled our innovation track record, and I would just want to highlight a few things. I mean, when we brought the Atos to the market, cyclotorsion compensation and centration were already included. When we connected, as mentioned yesterday, the OCT, so the MA39 is connected to the Amaris and the Atos since a few years now. You can use the epithelial mapping of the MA39. There's the Foresight, which provides a visual outcome visualization, which I'll allude in a few minutes. And now we are improving centration with the Atos. Not going into the details of that picture, just underlining that innovation is not only about the product, innovation is also application and workflows, and local or basically service and application support. And for us in India, that means working with a strong partner since many years, which is a Care Group, actually, which you certainly all know. So application support, as I mentioned, so it's basically expanding before and after what the laser is doing in itself. So Foresight, which we launched at the ECRS this year, is about taking a look into the future before you do the surgery. So you can basically look at the outcome, which you will have next day, and you can do improvements to your surgical planning if you like to. If you want to dive into more details, Dr. Roy, Dr. Puja are already using this software extensively, so you're happy to talk to them. Welcome to talk to them. As mentioned, we want to keep continuing innovating on the Excimer as well, to build on Dr. Shar's comment. There is no one-size-fits-all in our perspective, so the future belongs to both femto and Excimer. And that's on one hand on the communication side, helping you surgeons to communicate the benefits of that great technology to the patient, and on the other hand also expanding on applications. On the Atos, of course, and since we're at the Lenticule Congress going into more detail, so one important element I want to underline is that we really wanted to transfer all the benefits of an excellent Excimer into a femtosecond laser as well. So we don't think you as a surgeon should compromise in lenticle surgery versus a track record of many, many years and decades of surface and LASIK treatment. So to underline a few things, eye tracking, as I mentioned, centering, but also tissue saving and the transition zone, which is built in the lenticle shape of the Atos. Going forward, or short term, certainly the femto will continue to evolve. There's the continuous innovation we have been doing with the Amaris will be replicated or is being replicated on the Atos. Short term, we launched at the SURS further improvement on centration, Centrex, the ring segments in the Atos, also simple astigmatism treatment, and midterm we will expand in towards new procedures and also integrate the Atos into, let's say, the planning platform. So I'll come to an end soon. More longer term refractive index change, going beyond what we do today with the femto, basically sub-threshold, sub-cutting threshold treatments with the femtosecond laser. That's, in our perspective, a big opportunity to address the fear factor, but also an opportunity to do presbyopia treatments, post-cataract retreatments, and treat thin corneas with the femtosecond laser. And I would also mention here the combination of laser correction with the biological treatments mentioned many times by Dr. Royd as well, since that is also going beyond what we do today in laser vision correction. So to summarize, great results for better vision. So let's continue innovating in products, in treatments, and in application in order to grow from the 3 to 5% today to more than 50% and capture the huge opportunity we have together as industry and as surgeons in laser vision correction. Thank you very much.